Let's go. Thank you guys for being with us. I'm the ball-headed guy on the right there, and my partner, he did that picture on purpose, so kind of cut the hair off, but he's got more hair than I do. He's just trying to be nice, and we've been doing this a long time. We're both diplomats. I live in San Antonio, Texas, guys in Bradenton, Florida, and we're happy to be here tonight. Talking to you guys.
Yeah, this is all we do. We've been doing it for 15 years each, so over 30 years of experience, and we do this every day, all day long, and we're going to help you understand how to get involved in dental sleep. We want to thank Keller Labs. We've been working with Keller Labs about as long as we've been doing this, probably going on 15 years. They do most of the devices that we do, and we use them for a lot of our dental sleep devices. Coming up, we're doing a continuum on this webinar, so we'll talk at the end about the upcoming webinars, more to do about devices and so forth, and talk to Keller Labs that they can answer a lot of your questions. My favorite device that I wear most every night myself is this one right here. It's the dorsal design that Keller has. It's a injection molded dorsal design, so it's one of the strongest ones out there, and it can be made very thin and comfortable. And again, when we talk about devices in future webinars, we can talk more about it. And a lot of you have been using Keller for years with these NTIs, and we don't have a ton of time to get into a lot about bruxism, but we can tell you bruxism has a lot to do with at least at night, with some patients have airway problems, and we sometimes use these NTIs to get their muscles to calm down, and then we also use mandibular advancement devices. And lastly, I'll run through this. We want to thank our partners at KKGI. They've been doing an awful lot really to raise awareness of airway problems. Their imaging is helping to help screen more patients and identify them, and I've personally been using that unit you see there, the OP300, in my office, and it's a great unit. If you have any questions about that, there's a contact information for you there. I see a question coming in about the volume. I don't know, that's probably on your end, I would assume, unless a bunch of people are having volume problems.
No, I got you loud and clear.
Okay.
Just on the bottom right, usually you can click something, find your little speaker, and turn it up. Can I say that, guy? I'd love to say that. Dental Sleep
Absolutely.
Solutions, we're the most trusted, innovative, and customer-focused provider of solutions in dental sleep medicine, period. That's what we do. Guy and I hooked up about, 8 years ago now?
Yep.
And we just decided we wanted to help dentists implement this in their practice. We were going to the AADSM, and heck, I was president-elect of that not too long ago before I met you, Guy, and they kicked me out. But But we want to help dentists do this, and we put our heads together, and we have a software system, and we do. I think the next slide, Guy, tells a little bit. We do. There's a lot of questions that you have as you get into this, and the software is the backbone of what we do. But we have tons of education built in there, and Snoozle's little sleep medicine search engine that you use, and we're all about trying to help dentists do this. That's why we do a lot of these webinars. That's why we're here tonight talking to you guys. So we give you a short commercial on ourselves too, but we want to help people do this.
Absolutely. Just to be clear, they didn't kick you out because you met me. Let's make sure that's clear. Rich was president-elect at AADSM and did a great job, but due to the restrictions they have on commercial enterprises, it's a nonprofit organization. You had to gracefully step down. So it wasn't because of my relationship with you. Let's just make real clear about that. We do courses all over the country. I'll put this up at the end. A couple things we'll talk to you about today. If you're interested in doing these courses, some of them are one-day courses, some of them are two-day courses. If you type in course and where you want to go, the one-day courses will give you $50 off if you type that in tonight and sign up by tomorrow. And we'll give you $200 off on the two-day courses. The two-day courses are great. You actually get a dental device made by Keller and one of our labs, and just that alone and the two-day course is worth the price of admission. That's $995, so you minus $200, $795 for the two-day courses. The one-day courses are $295. minus $50, $245 if you just type in course, and we'll get you going with that. And the team member on the two-day courses, you even get a team member to come for free. They're really great. We also offer anybody that wants to try our services out, and this, I promise you, at the end of any of our commercials until the end, we'll go over it again if you have anything that you want to know about us. We're so proud of what we do that we will be happy to help anyone for a few weeks just to show you how we can help you with dental sleep in your practices. No pressure. Show you our whole system, education to implementation system to the software to help you do this in your practices. So with that said, we're ready to get going, and dental sleep medicine is at least on a bunch of your radars. We've got quite a few people on here tonight, and so at least it's enough that you're taking your evening to be here with us. Did you see this in the paper, Rich, about a month ago?
I didn't. I'm glad you put that in there. You know, the Supreme Court judge that passed away. Yeah, where did you find that?
I just saw it on the internet, and basically he had his CPAP unplugged sitting beside him, and this was a quote right out of the paper. You can Google it yourself. Another one that within the last month, a little over a month, is that the DOT, I'm not using the right word there, but the Truckers
Motor Carriers Safety Administration.
Thank you. Couldn't remember what that stood for. Basically, are trying to mandate that their drivers get screened and tested for sleep apnea. So you don't have to look far to see that this is something that is really, really growing in dentistry and in the country. And I think, you know, this is maybe one of the more important slides we'll talk about just from a high level. We were told to save teeth, and that's important, but with what we can help you with is we can help your restorative practices be more predictable. We can still help you save teeth, but you know what's really neat is we have stories upon stories about where we literally change and save our patients' lives, and that's pretty rewarding.
It is, and you can do this. You should be doing this, or you're at least screening for it, right? You were talking about this dentist in your practice, guy, and how you're making his cases go easier now, and what I think we don't realize is that these people are just walking through our doors every day. We just haven't seen them. We haven't noticed them. And that's kind of what tonight is about. Tonight is about kind of getting your arms around this whole thing, and what kind of opportunity is there, and as a dentist, how can I get involved in this?
Yeah, and Rich and I, like he mentioned, really came together about 8 or 9 years ago, and I think the practice parameters really changed things for me. The American Academy of Sleep Medicine, so the physicians back in 2006 basically said, you know what, we're looking at these studies, and dental devices seem to work quite well for mild to moderate patients, and you know anybody who can't wear a CPAP seems to get a pretty good benefit from these dental devices, and they should be made by a dentist that's had some training in dental sleep. And so, you know, prior to 2006, we didn't have as many insurance carriers wouldn't pay for the devices. Physicians were resistant to recommend them, and things have really come a long way in about 10 years, including the update. You want to that was just last summer, right, Rich?
Yeah, that came out, and you know, we the previous slide. Go back to that for just a second, Guy. and I know you talked about, you know, that's the day the earth shook for us in dental sleep medicine, because there were a lot of hurdles there for us trying to get this done. And holy cow, man, the medical community does a review of all the literature, and they say, okay, hey, for mild and moderate, you can use it as a first line of therapy. Okay, go to the next one now. So 10 years go by, and more dentists are getting involved. More and more physicians are saying, hey, what should we be doing? You know, we do something like this, and we get hundreds of dentists that get on here just to learn about this and do this. So we really think we're kind of at the tipping point where more and more people will do this. And first and foremost, let's just go through these quickly. There's enough evidence out there that says snoring is really bad for you. In fact, it's standard of care for the MD is they need to prescribe dental device treatment for snoring. And that's a step up and in the right direction. They mandate that a qualified dentist use a custom titratable device. We'll talk about that a little bit. The ones that you can get from Keller are custom and they're titratable. And a qualified dentist is somebody who has 25 hours of CE. So, and if a patient refuses PAP or they can't use it, then the physician should steer them to a qualified dentist. The qualified dentist is the one who provides the care and does manages the side effects. And you know, lastly, the MD is the one who does the follow-up titration sleep study with the dental device in place. And it's very important that you don't just give a patient a dental device and say, here you go, good luck. So in some ways, I think this is a little bit of a step backwards, but in other ways, it's forcing us to work with the physicians in our community. And this is why we're here. Let's see if this will play, Guy.
Yeah, it should play you know, when you watch this video, this is understanding that most people that have this problem don't know they have it. And for those that do know they have it, a lot of them aren't successfully treated. And there's really nothing more we can do for our patients than let them know about this. You hearing that all right, Rich, on your end? Is it hearing the snoring?
Yes.
Okay. So look, the patient's breathing. Again, he's not aware of these problems typically, and then he quits breathing. And why he quits breathing, there's a blockage, a cork in his throat, basically, that's going to keep him from breathing. You can see his chest moving up and down. And think about what he's doing here to his blood pressure, to his heart. His oxygen levels are dropping. You think he may have a headache in the morning. You think he may grind his teeth. A lot of the things we're treating for. You think he maybe has some GERD. You think some acid may come up in his mouth from all that pressure right there. And again, what's going to keep him from dying? Because he's never died yet. Nope, see, he didn't die again. You know, what caused him to actually breathe there, and why is he not even aware of him doing it? So we could watch that for hours, and understanding that 85 to 90% of the people who have that problem just don't know they have it. They just think they snore, they wake up maybe not feeling great. And what's going on here? It's pretty simple. The airway becomes narrowed as we fall asleep. Our tissues, our muscles all become relaxed, and if you have a narrow airway, the air is going to go much quicker through that airway, and that makes the sound we call snoring as it goes quicker and hits some flabby tissue. And eventually it can collapse. The airway can narrow to the point of what we call apnea. Then you get hypoxic, and then you have some pituitary action because you're arousing from sleep. So he went from deep sleep into lighter sleep. His muscles contracted. He opened up the airway, took some big breaths, and then the whole thing can kind of start again. Again, most people that have this happen don't know that it's going on.
That's kind of hard to believe, isn't it? A guy like that goes to sleep. And I think maybe part of this guy is it just becomes the new normal. Hey, I'm getting older. I'm tired. I'm a little overweight. I don't have quite as much energy as I used to. How many of us can say that? Probably about 9 out of 10 of us, right? And so part of what we want to do is for you guys to get your arms around trying to identify these people and why we think as a dentist you're important to do that. But, you know, you got to remember you got a tube that you're trying to breathe through, and you create this negative pressure inside your lungs, and you're trying to get air through your nose and your mouth, and usually the place that's the smallest is that place right behind your tongue. So you have these opposing forces that are acting on your airway itself, and the term we use to talk about your airway is compliance. So the more compliant your airway is, the more it's like a cheap straw. When you try to suck milkshake, a good milkshake through a cheap straw, you can't suck too hard there because the sides of the straw cave in. And we've got these opposing forces, and our airways are just closing down. You know, but part of that has to do with being overweight. But I love this thing, Guy, and point the tongue out there, and then let's watch this MRI.
Yeah, so you've got the tongue here, and one of the things I always say when I show this is, you know, if there was a cancer, you know, some suspicious lesion on that tongue, would we feel it's our problem as a dentist to send that patient in for a biopsy or to have it looked at? If there was, you know, we would say yeah, because the tongue's in the area that we have to deal with. And my question to you is, whose responsibility is it when the tongue, my PowerPoint's just decided to quit. This isn't good. When the tongue falls back into the airway. This is not good at all. I've never had that happen during these webinars. There it went. Okay, it's restarting. That's fine. We'll just keep going for a second. So the tongue basically falls back into the airway. That's one of the reasons that we have airway problems, the airway collapses, and it's not the only reason. But my question for you would be is when that happens, you know, whose problem is it? Is it our dentist's problem? Is it the physician's problem? Is it, you know, who's going to find this? And can you see the slides now, Rich? It's back up.
They've never gone away from me, guys, so I keep seeing it. It's just stuck on the picture of the guy with the tongue. I haven't seen it move yet.
Yeah, hold on. Bear with me. I'm very sorry, but this will fix it very quickly.
But we're talking about, you know, the tongue is an unbelievably big muscle. When you look at that, it's, you know, nearly as big as a golf ball in there.
There you go. Did that do it?
Yeah, try it one more time. See me back here. because we lost you there for a second.
There we go. My PowerPoint decided to reset, but there you go. Sorry, everyone, for that delay. But, you know, that happens, and who's, you know, the primary cares just aren't getting this. One of the people I talked to today, who's a dentist who's really screening his patients now, and he mentioned his cousin, I think it was in, has been to the doctor, you know, dozens of times, and has all kinds of medical conditions, and because of him, she went and got a sleep test and has very, very severe apnea. So this is where we can help our patients by understanding this, but we can't do it alone. We can, we need to help with our physicians to do these diagnoses, right, Rich?
Yeah, you have to understand that we cannot diagnose this as a dentist, all right? So we do 2-day courses on this stuff, and we could talk about this stuff for hours. But just right now, I think our job as dentists is to start recognizing this in our practice. We talk about how we can screen these people, and we see these people. We'll talk tonight about, you know, dentally, what do you see and how might you see some of this stuff. But you just got to remember that you have to collaborate with physicians. So in New Jersey, you're not supposed to order a sleep test as a dentist. You know, something came out in Georgia that said, hey, one of the payers said we're not paying for a sleep test if it's ordered by a dentist. So, you know, you got to check with your local state boards and things like that. But in general, we want to help facilitate that sleep test. We want to identify these people and you know, start the process. But you can have a sleep test in a lab, or you can have one at home. Right now, which kind of people get, Guy? They get the one their insurance pays for, right? Let's assume that you have a diagnosis.
Yeah, and that's a whole nother time. We're going to be talking about testing next time, so we'll get into that in more detail. But assuming we get our patients tested, there's really 2 first-line of therapies recommended by the American Academy of Sleep Medicine, and the CPAP is the most common, and then dental devices. There's other things listed here, surgeries, positional therapy, and weight loss, but really the first line of therapy in most cases are the 2 things that we can provide that are non-invasive, and one of them is what we as a dentist can provide. And what's the difference here? I think everybody kind of understands what a CPAP is. It works quite well, but dental devices in many ways are more comfortable for a lot of patients. Patients tend to wear them more. They you know, if you give patients a choice and one will work in both situations, then most patients will choose a mouthpiece to put in as opposed to a CPAP, which has a really good chance of opening the airway, but has a little less chance of
being warned.
Right.
Right. So compliance is an issue with CPAP when we look at this. So it's the most common thing out there. When you send a patient to a sleep lab and they get a sleep study done, your local sleep physician is going to tell them, look, you need CPAP. So part of what we need to do as dentists is we need to get out there and we need to talk to these people. You know, we hear from the sleep docs all the time, I don't know a dentist in my community that I can refer these to. Well, that's our fault as dentists. We got to go introduce ourselves. We got to say, hey, I'm screening my patients now. Can you do the sleep studies? Oh, sure I can. Well, I'd like to try to make a dental device for them. So how many people have this out there? We have millions of people that have this, yet only about 10% of the people that have it know they have it. So it's unprecedented, isn't it, Guy, for a medical problem? It's just amazing.
Yeah, I always say it's one of the most undiagnosed, untreated serious medical disorders in our country. And the reason is, like I say, most people don't know they have it, and then when they have it, they get a CPAP, but they have to wear the CPAP. And that's the trick. The people who wear it well every night, it's a great life-saving device. How do CPAPs work? They work by having usually a nasal CPAP that is hooked to a machine. This machine's a blower. It's not, you know, a lot of people think lay people think it's oxygen. That's not what it is. It's actually positive pressure that kind of blows open the airway. And, you know, we look at some of the earlier ones here. I mean, I just throw that in to say how it's coming. Even this one was about 10 years ago in my office. I took this picture, and one of one of my patients came in. I said, let me just get a picture of you wearing your CPAP. And you can see she was just kind of stressed just putting it on in the office. Her hands were kind of clammy, and it caused her some strife just by putting it on. And this is my favorite. I really pulled this off the internet as an ad. It was an ad for, here's what you can have. Look, here's what you want. You've got your nice sheets here and your glass of wine or whatever back here. And then look at this. I mean, this is what we actually strive to have that. And I tell you what's fun about this in dentistry is, we spend a lot of time talking to our patients about having a crown versus a filling and all the virtues. And really, if a patient understands that they have apnea, or some sleep disorder breathing of some sort, and they understand the significance of that, and they want to treat it. So we've gotten them to that point. And you give them these two choices, I mean, which one will most people choose? It makes what we have, it's kind of fun because a lot of things we do in dentistry, maybe we have to talk them into our choice. And I can tell you, I have some airway problems. I snore and have some resistance, and I wear a dental device every night. I don't wear a CPAP. And in other countries, Rich, look at this. This is the U.S. You want to talk about that?
Well, that's kind of our soapbox, isn't it? As dentists here, we get up on this. So a couple of people call what we do different things. So one of the other dental device manufacturers out there calls this continuous open airway therapy. We like the term, Guy and I like the term mandibular advancement device. We don't like to refer what we do as an appliance. That sounds too much like a refrigerator, I guess, for us. So we talk about our dental devices, but there are other countries where dental devices have more market share than CPAP does. And if you think about this, Guy, think about when John Remmers was figuring out what sleep apnea was in the early 80s. Had you and I been sitting there and we said, hey, Guy, what do you think we just grab a hold of this guy's jaw and move it forward? We would have had the head start, and then how hard would it be to try to sell CPAP to somebody? It would be very hard. So
it would be difficult.
But the thing that's happening is that more and more dentists, like you all sitting there at home or at your office still listening to this webinar, more and more of you are screening your patients, you're introducing yourself to your sleep physicians and your primary care docs, and you're making more and more dental devices. And every year this is going up. In fact, I think your next slide has something to do with that, doesn't it, Guy?
Yeah, so Frost & Sullivan is one of the world leaders in growth consulting. So they look at market trends in various demographics, and they looked at dental devices. And from 2015 to 2020, they're predicting a 5-fold growth in oral appliances over the next in the U.S. over the next 5 years. And so it's going to grow from 190,000 units to over 1 million, according to their predictions. Even if they're only 50% right, there's a lot of growth there that's going to happen in the dental sleep world. And we've got hundreds of people, well over 100 on here tonight, which is great. So you can tell by the number of people that are really getting involved in this. And by the way, I see some people typing in questions. Keep doing that. We will get to them all before it's over with. So just type them in the questions box. And for those of you who got in here a little bit late, we'll show you those courses at the end. And if you want to come to one of our courses, just type in a course and what city, if you know, we'll give you $50 off the one day and $200 off the other, and we can talk about the free trial at the end as well for those who got on here late. I think this is really what's changed, right, Rich? Since you and I have been involved in this in the last 8 or 10 years, I think we've started looking at this a little different as a medical community.
Well, we've been trying, haven't we, Guy? I mean, everybody says, hey, CPAP works, every time. Well, number one, CPAP does not work every time. There is a paradoxical effect. People get worse sometimes. Up to 10, 12% of people can get worse when you put them on a CPAP. But the biggest deal is, if you got a CPAP machine and it's sitting on your nightstand and it's not plugged in.
Like the judges.
Like the judges, exactly right. How well is it working? It's not working at all. So, yeah, go through this little exercise here.
Yeah, so let's just assume someone's having 100 apneas a night, or however you want to look at 100 apneic patients, however you want to look at that. But let's say the CPAP is 100% effective, just for the sake of argument, even though I agree with what Rich said. But the patient only wears it half the time. They wear it every other night, or they wear it half the night and take it off. Then the overall effectiveness of that treatment is 50%. or 50 of the apneas would be helped with that treatment. Let's say a mandibular advancement device is only 70% as effective. It doesn't, get rid of all the apneas, but it does a fairly good job, which is pretty much what they do. In some cases, it's better than this, some worse. That's a pretty conservative estimate. But most patients will wear the dental device most every night, most all night long. So in this case, because of the compliance outweighing the efficacy, we end up with a 70% overall treatment effectiveness. And you can play with the numbers all you want, but what you have to realize and you have to embrace, and the medical community is starting to get this, is that the compliance is as important as the effectiveness of the treatment. The efficacy without compliance is zero, and vice versa. If we don't have, we've got to look at both. And that's why there's room for both CPAP and dental devices, because there's not one shoe fits all in this world. This study here showed some pretty good results. I think it's the one I use the most. Would you say, Rich, is one of the ones that's most quoted and that you use the most in your office?
I would. It's absolutely the best study that's ever been done on this. We just had a question on this too, so I was kind of typing in the answer. So rather than type it, I'll tell you. How do oral appliances compare to CPAP? So the updated practice parameters that came out, they looked at every single study that's been done on this, and there were about 500 that they chose to include in the practice parameters, and so they looked at this. So, because people want to know, your physicians want to know, well, who's a good candidate for dental device therapy? Well, anybody who's breathing, is a good candidate. That's the short answer. And the best study that's ever been done, we can talk about this study for an hour, Guy, but they did a wonderful job of age matching these patients and BMI, and you get the same 50-year-old guy that's the same, overweight and all this other stuff. And if we just look at trying to get their AHI reduced in half and get it below 20, then the oral appliance, it's actually better than CPAP in the non-severe cases, and it's not quite as good as CPAP, for the severe cases. Right. Now, most people say we want to reduce the AHI by half, and we want to get it to below 10. I think that's your next point, Guy.
I don't think we have that one in there, but basically you can go to the appendix, and they rescored that, and the mild to moderate version, so this didn't change. We were able to do that. It dropped the severe down some. A little bit. And both treatments work well for symptom relief across the board. Dental devices seem to work as well as CPAP across the board as for symptom relief, and both of them substantially reduce the number of events. The more severe someone is, maybe the less likely a dental device will reduce as many events, but there's still a great place for dental devices. Most people can benefit immensely from dental devices, and I think this kind of is a take-home message from that, isn't it, Rich, from those practice parameters you were talking about earlier?
Yeah. Well, we're trying to get in here the adherence as well too, and that goes back to the slide you made, Guy, about the efficacy. When we're doing that. So, and remember, successful CPAP use is 4 hours a night, 5 days a week, and that's not really a lot of treatment. I mean, really. So we want patients to be treated when they're asleep. When they're asleep, their airway closes down, and we've got to figure out some way to try to help our patients, when we do this. So. Right. But at least they're taking that into consideration now. So this is from the Matrix, and what does Morpheus say to Neo, right? You can take the red pill and go back to life as you knew it. And we think that your life before you hear something like this is you see some dental conditions like abfractions and bruxism, and you make somebody a dental, splint. A night guard, something like that.
Flat plane splint, yeah.
Yeah, flat plane splint. And we don't think you should be doing that. Do some people need flat plane splints? Of course they do. You got to use your brain. But we want to change your life and how you look at your patients and what you do.
Right. And I think there's room for both of these. I think the take-home on this, that some patients benefit from CPAP, some from mandibular advancement device, and of course some people maybe need just an anterior guidance flat plane splint of some sort as well. But, when we think about bruxism, we think, wow, that's bad, and we really want to, we get really stressed out about it. Think about all this stuff, Rich. I mean, everything on this screen has some independent association with untreated, at least severe sleep apnea. So independent of other issues on there, and you can you know, we don't have time to go through every one of them, but, you know, everything from diabetes, obesity, hypertension, cause and effect relationships, even weight gain is caused or worsened by untreated sleep apnea due to various reasons. So do we want any of this stuff? I mean, this is all, if someone realizes I'm at risk or have these things and I'm going to possibly get these things, but I can wear a piece of acrylic at night that's going to hold my jaw forward to prevent them, and I'm going to feel better and wake up every day better. You know, it's a pretty easy decision once the patients really grasp what's going on.
It is, and it's scary. I mean, my gosh, you look at how many people snore. You know, at 40, it's about 40% of the population. At 50, it's 50%. By the time you're 60, it's in the 60%. And depending on which study, it's anywhere from 15 to 45 million people have sleep apnea. And I love this one, Guy. Almost 1 million CPAPs a year are sold that don't even get turned on. I mean, people go home and they never even take it out of the box. So
if they do, they're not wearing.
Right. We got to find these people, man. As dentists, we got to find these people. When you see somebody that's got high blood pressure, they've got AFib, they snore, they're tired and sleepy during the day, they got diabetes, you think that guy's got sleep apnea? Yeah. You know, by the time you start adding those all together, you're at 90%, you know, the people have it. So a lot of people have this, and a lot of people just don't know they have it.
I think one thing I'll mention is the medical community kind of gets this one when people are obese. Oh, okay, maybe we'll send you in for a sleep test. But I think where the dentists can come in are the non-obese patients. The dentist I was talking to today with his aunt, she's not obese, but she had high blood pressure, diabetes, a lot of other red flags. The medical community didn't catch it because she wasn't obese. And somehow we have this stereotypical thing in our minds that you have to be obese. So these are the red flags you should be looking at when you see these things in your patient's charts. 30 to 37% of the hypertensive patients, we should be thinking, oh my gosh, something else may be going on with them other than just grinding their teeth at night or whatever we're zoning in on their teeth. And I think this is a take-home message too for the night. This is fun. I think Rich made this slide a long time ago, and I live by it. It is absolutely the right thing to do. It makes you feel good at the end of the day, and it's very meaningful. Nothing you're going to do in your dental practice can more profoundly change your patients' lives and probably be any more important to those patients' lives in the long run than helping them understand if they have airway problems and then helping those who are candidates and to treat them for airway problems. It's just a good thing to do in your practice. We already hit some of these. But these are the three big ones here, right? What are they, Rich?
Well, how do we know people might have this problem, right? Most of the time they're snoring. Now, you can have sleep apnea. Think back to that video. That guy hardly ever breathed. So that's why he didn't, you know, he may have not snored much. You could have been next to that guy. But people are sleepy and tired. They snore, and they're disrupting their bed partner's sleep as well. And they have high blood pressure. So when we see these types of things, a little bell should go off in your head. Holy cow, man! We need to at least have a talk with this guy about this. What else?
If you think of nothing else when you go back to your practices tomorrow, ask these three questions. You probably already know if they have high blood pressure from your medical records, your dental, your health records. But ask, do you snore and are you sleepy? And we'll talk a little bit more next time about how we know about those. But they have even one of these. Certainly, they have two. That's through the roof as far as their odds of having airway problems. Here's a bunch of other ones we don't have time to go into individually, but just recognize these should be things that once you start seeing these, that you are going to start thinking, wow, has this patient been tested? And maybe we need to start talking about it. Here's a whole bunch more kind of all on one page for you. A lot of your patients have these things, and when you start checking these off, we should start thinking about whether they may have airway problems.
So I love the term you used with that guy, the red flags. So you guys are all pretty much reviewing medical histories. Your hygienists out there or get an A+, dentists get a B+ on that usually. So the hygienists are doing a better job of that. But you've heard some of the medical comorbidities and some of the signs and symptoms. And now let's talk just for a minute about, we're looking at people's mouths all day. and they open their mouth, and you see this. You know, what the heck's going on there, guy? I mean, what's making all those marks on this guy's tongue?
Well, it's the teeth. We were taught about scalloped tongues, and I think we all kind of recognize that maybe these are the indentations of the teeth. But if we go back to the slide that seemed to crash my PowerPoint earlier, that's a muscle. That's what that tongue is. And when we get to REM sleep, that all of our muscles become more or less paralyzed, and that tongue's not immune to that. And what happens to that tongue? Why are there marks on here? Well, maybe that's because that person's pushing their tongue forward throughout the day to keep their airway open. Maybe their arches are narrow and they don't have room for their tongue. Maybe their tongue's large. All those things are likely or possibly true, but the bottom line is, if that tongue is pushing on those teeth enough to make those marks, and then that tongue becomes, you know, completely relaxed, more or less paralyzed, and that patient rolls over on their back, what do you think is going to happen to that airway? And who's in a better position to see that while they're doing their hygiene appointment or doing the a filling or a crown on that patient?
Very well put. And you don't have to have a class 2 occlusion to have sleep disordered breathing, but if you take that big tongue and you put it in this guy's mouth, that's like strike 1, strike 2, right? Yeah, when just everything's closer to the back of his throat, and he's going to be more crowded. So think about big tongues. Think about mouth breathers. You know, look in the back of somebody's throat. My gosh, how's that guy even eat, guy? I mean, he's got to chew up his food really good. You know, that's an all-star uvula there, and the palate goes back forever. And, you know, I holy cow, man. I mean, that's just a lot of stuff back there.
How are they getting air through there when all that's relaxed? And what'd you call that, an all-star uvula? That's a new one on me. I like that. So, you know, and here's one, you know, we need to think about these vaulted palates, these V-shaped arches. You know, they're that way for a reason, and we don't have time to go into all of it, but basically when you see this, it might be a developmental problem, that the patient was a mouth breather, their arch didn't form normally, and that maybe they have an airway problem, and they're certainly more prone. That's pretty well established. People with high vaulted palates, long lower face heights, are just like the retroanaptic patients, are more prone to airway problems. And we could spend all night just talking about that, but just start thinking about this. And I tell you what it's really done for me with the having a restorative practice for 25 years, being a restorative dentist for that long. This is one of the pieces of the puzzle that is starting to make sense, and some of the patients that I look back on had issues with certain things, in particular bruxism. You know, maybe we weren't looking at the right things, and we could spend a long time talking about Dr. Mallampati here, but you want to explain? I'll let you explain the Mallampati if you like.
This is what the physicians use to when they're getting ready to intubate somebody, like an anesthesiologist. And basically, I can see all the airway, the back of your throat, or I can't see any of it, or in between. So there are studies that say, okay, if you got a Mallampati 3 or 4, you're more likely to have sleep disordered breathing. So again, we're just trying to give you guys ideas of who these people are. They have headaches. You know, people come in and they have headaches, and we go, oh, open and close your jaw. Oh, it clicks and it pops. Holy cow, we need to make you a night guard. They might need a night guard. Don't take that the wrong way. They might need an NTI. NTI does a lot of good for a lot of people, but we think that asking a few more questions: are you sleepy? Are you tired? Do you snore? Do you have high blood pressure? Diabetes? Are you having mentation issues, can't remember things sometimes, all of those types of things. So let's just start thinking about this. And of course, we do webinars all the time. I don't know if we're doing one for Keller this time on sleep bruxism, but it's a popular one. We do a lot of that. But you know, and we see these things, and we see people wearing their teeth down. You know, people can do this during the day, so there's awake bruxism and there's sleep bruxism, but sleep bruxism is a movement disorder, and it's a sleep disorder. You know, we think as dentists we own sleep bruxism. We don't. You know, the board-certified sleep physicians think they own it because they can put a CPAP on somebody and they can get rid of their sleep bruxism.
They can certainly decrease it a lot, and again, to reemphasize that, it's a sleeping disorder that affects the teeth. And we've got to start thinking about both. I think we as dentists understand the relationship there. It can make it worth all your all's time for being on here tonight and taking your evening as well. So again, if you have questions, keep typing them in. Rich is getting to them. We'll have time at the end to go through there. And I see some of you have typed in for the courses. Again, if you want to do that, just put that in that you want to come to one of the courses, and we'll give you that $50 or $200 off or the free trial. We'll get to that again at the end. I think
a lot of red there, isn't it, Guy?
That's what I always say. Remember the red pie. You know, when you get up tomorrow and you think, what did I learn from listening to those two guys last night? If you think of nothing more, remember this red pie, and remember that the red part are the people who don't know they have airway problems. The little pink sliver here is the people who've been successfully treated out of these all being diagnosed. So 80 to 90%, we're being very conservative when we say 80% of the people don't know they have it. I mean, it's probably higher than that by most studies. But look at that red pie, and who is going to solve this? Rich and I started Dental Sleep Solutions because of this picture you have right in front of you. We were frustrated because our patients don't know they have these problems. The medical community is trying, but they're not successfully solving this problem and haven't for many years that we've been trying. And we're going to talk in just a second about why we think dentists are in the best position to help. It's an awareness problem. It is truly an awareness problem, and it's an awareness on the public, awareness to the physicians, and then we as dentists need to be more aware of it. The public's coming up. I mean, I see things on TV, maybe I'm looking for it, but you see news shows talking about it, different talk shows during the day, and the physicians are looking more for it, but they're still, I just mentioned a person today that's fallen through the cracks. I even have had conversations recently with a physician who's getting involved in starting sleep labs who didn't even know the practice parameters that we went over earlier, and didn't even really know what a dental device was. And that's kind of scary to me. And the dentist knowledge is going up. Yeah, if we all work this together and the public's aware and the patients who are at risk get tested and get appropriate treatment based on, you know, their level of apnea and what's appropriate for their particular situation, we can make a big difference in this. And I'll say it again, I call it a health care crisis. And, you know, I think this is
tremendous. Can I say one more thing on that, Guy?
Yeah, sure.
I mean, think about it. We got a couple hundred dentists on this webinar tonight. If every one of you in the next week spoke to just 2 physicians in your community and just made them aware that you're screening your patients for sleep disordered breathing and you're learning more about how to make dental devices to do that. You know, this is what is starting to happen all around the country. We've been preaching that for several years, and as we start to do that, let's quit pointing the finger at somebody else. Let's look in the mirror and point the finger and say, okay, well, I got to take some responsibility for this. So we've got to start doing this. And as we do that, what you're saying, Guy, about the rising tide?
Yeah, all the boats will float higher. Well, I mean, so, you know, I train dentists in my area. As a matter of fact, the dentist I spoke to today who refers me patients, I said, why don't you come to one of our courses, start doing this yourself? He said, you know, I'm going to someday. I'm kind of busy, but at least I'm screening now, and he's sending me patients. I mean, it's just the more people that know about this, the more it's going to go up. And there's not enough dentists in the country that know enough about this to even solve the problem if the awareness was greater. So we've got to increase the awareness. Then we also have got to increase the dentists who know how to do this and have the systems in place to make this, you know, something that they can do predictably and comfortably in their own offices. And then we hopefully can accomplish something. One of the reasons we believe this is more patients have spend more time with their dentist, and I believe they have a little bit more of a intimate relationship as far as kind of knowing, you know, we spend time with them, we talk to them about where, you know, what their hobbies are, and you know, we see them at social events. We just seem to know our patients better than the physicians do in a lot of ways. At the very least, we spend more time, we see our patients more often than the physicians do. So from that alone, we're in a better position to make the awareness go up. And Rich, you did this a long time ago, and I don't know that a ton has changed since then, and I think it still falls to be pretty true, right?
We suspect sleep disordered breathing in 10 patients, for example, in the medical model. So we're going to tell them, hey, go get a sleep study, okay? So how many of them go? Typically the PSG or the in-lab study has been a very high barrier because people say, I don't know if I want to have somebody videotape me. I don't know what I do while I sleep. I can't get away. I work at night. I do this, I do that. So there's a hurdle there. So not many of them go get a sleep study. And then of the ones that go, we actually diagnose them with sleep apnea. So we're going to confirm a diagnosis in, say, 4 out of 5 of those people. And what happens every time, in the past, the physician says, hey, here's your CPAP. Go get it. So they prescribe CPAP. Half the people won't even go get it. And of the half that go get it, only about half of them will wear it. So
Yeah.
we could cheat a little bit on that, right? I mean, we could argue that, okay, maybe 6 or 7 would actually go get a sleep study, and we're going to confirm a diagnosis in most of those. But this is not far off from, this is the way it's been the last 20 years. It hasn't changed much.
30
but
years.
as dentists, 30 years. But what happens as a dentist, when we see these people?
Well, I'll take over. I guess a little delay there. I apologize, but what Rich was saying, right? You can play with these numbers all you want. Really, 1 maybe out of these 10 will successfully wear their CPAP every night, most all night long. If we as dentists suspect these patients, and I have to say, the funnel putting people into the suspecting is going to be greater because we're going to be more aware of this if you've taken any education on this at all, which is we'll get more people added to that 10. But how many can we get them to get wear a home sleep test and just wear something strapped to their head or chest for 1 or 2 nights at home? I can tell you 9 is not an exaggeration because I can tell you Rich or I come to your office, we'll get everyone to do it. We're just that passionate about it and believe in it. So let's say 9 of them you can get out of the 10. Most of them are going to have apnea or at least some form of sleep disorder of breathing because we're only doing these on patients who are at a high to severe risk. Most of them will wear a device. Maybe some of them won't wear it every night all night long. There's some studies coming out with some monitors that are in some of the devices, and it's pushing 90% compliance, the high 80s, every night all night long for compliance with dental devices. So, I mean, even like Rich said, even if we're off a little here, even if it's 6 versus 3.
Yeah, let's cut ours in half and double theirs. We still have a better model. We still have a better way to do this. But more of you dentists out there have to learn about it. More of you got to start, screening your patients. More of you got to start doing this. And, Guy, I remember you in those days, man. You used to complain to me all the time. Oh, my back's killing me. No matter how good we tried to work on our posture, that's how a guy ended up at the end of the day. His wife walking on his back,
Yep. Dentistry's hard. I mean, it's a tough job. It's fun and rewarding. I'm not taking anything away from it. I did sell my practice a few years ago, and this is all that Rich and I either one do now is treat sleep disorders with dental devices and help train some of you all.
Where'd you get that drill, by the way?
I mean, I'm not putting down dentistry. I was a good dentist. I enjoyed dentistry, but it was tough. There was days it was just stressful, and I can tell you, Rich, when I first started getting involved in dental sleep, I have 3 offices now, and when we first opened our satellite office, the first one and then the second one, about 1 day a week we'd go to the satellite offices, and it got more and more. And I tell you, the one day that I'm like, okay, I'm going to my office just to do sleep today, the restorative practice is going to kind of cruise on its own. I'm going to see some hygiene patients. I would just feel less stressed. And I remember talking to you saying, God, I'm going here tomorrow, and I'm just sleeping better tonight, knowing I'm not going to have as much stress tomorrow. And it's not without sleep, but I can tell you, dental sleep is very much a nice relief to put in throughout your patients, and in a lot of ways, it's a lot of reward for the effort. And I can tell you, it fits into the 3 things that I want to do in my practice. And I always give a little credit to the Pankey Institute. Rich knows I feel strongly about their help in me bringing up my restorative practice, and I learned some things from them and other mentors, and I made my decisions years ago that I only want to do things in my office that fall into 3 categories. And one of them is I want to help people. I want to make sure that at the end of the day they're thanking me for coming in, and they appreciate what we did. And I always say, I don't know if that's because I'm a good person or if I'm insecure and I need their reassurance, but this really does that. People will hug you and just tell you how great it was. The other thing, Rich, I think I've discussed with you many times is, don't we get patient? Isn't it something you enjoy in addition to the patient appreciation? It's something that's not stressful. It's not as technical, and it's just something I look forward to doing. And then the last thing is this slide that's on the screen is make money. It's wouldn't be a webinar unless my dog barks, so sorry about that. Always seems to happen. So hang on. And that's a schedule on the first page. That's my restorative practice. You can see all the time I had in my schedule that I was busy. All the black lines are my time, and you can see I hardly have any time to do much of anything other than see my patients. We've got a productive day there, but here's a similarly productive day in dental sleep. And for the offices that have good team members, I think this is the perfect thing to get involved in, because most of what needs to be done on a daily basis can be done by team members. And so that's one of the reasons that we hope to get you hooked on dental sleep here tonight.
I love that picture.
Yeah, yeah, it's fun and enjoyable. I will say that there's moving parts here. Each individual part is one of the easiest things that you'll do in your practices. It's not anything that's complex, but there's moving parts, and if any of these parts aren't in a line, you're going to, it's like a chain, and you need systems in place to help you succeed at this. So you really need a plan, and that's kind of where we fall in play. We can really help our people with this. Again, we'll bring it up again in a few moments, but if you want to just see what we have to offer, we can certainly help any of your practices with any of the questions that you have and getting a plan for dental sleep. And we're going to talk in the next webinars about what we call our pillars. The next one I think coming up next month is going to be on screening and testing, and each of these, what we call pillars of a successful dental sleep practice, is essential to being successful. And you can see we have dental sleep medicine below it. Dental Sleep Solutions can help build that for you. And if you get these pillars in order, we can make you feel like Rich and I, sitting back, relaxed, no root canals or extractions, and you know, it's just a whole heck of a lot less stress in many ways. So
yeah, we don't want to belittle at all what we all do as dentists. Guy and I are dentists. We practiced dentistry for a long time, and we're just doing dental sleep medicine now, and we're focused on our company, which is focused on Dental Sleep Solutions, which is focused on helping dentists implement this in their practice. So, you know, one of the questions we had, Guy, was from a dentist who's wearing. He said, "Man, I wouldn't even think about not wearing my CPAP at night." I said, yeah, I've got thousands of patients, you know, that feel the same way about their dental device. So everybody's different. We got to figure out what works for each one of us. But, you know, the dental sleep medicine train is coming, right? Yeah. I mean, it's on its way, and, you know, you're going to be on it.
Yeah, and the time's right. When Rich and I started, there was no track here. There was just a big mountain with trees, and, you know, the trees got knocked down, the foundation got laid, track got laid out, the engines are all stoked up. It really is the perfect time to get involved in dental sleep, because many of the hurdles that were monumental when we began, I mean, sleep testing, you had to go to PSGs to do this. The dental devices weren't even really recommended, so when we talked to our physicians, they would just brush us off. Medical insurances didn't pay for these things really at all. CPAPs, there was no compliance on them. Now we at least have chips in them to see if they're actually wearing it. So I mean, I can go on, but the foundation's been laid, and it really is the ideal time, because the hurdles are lower. There's people like us that can help you. That's what we do at Dental Sleep Solutions. DS3 is our foundation. It's what we do to help you along the way with our cloud-based software. But we do way more than that, because we're hand-holding. We have courses. We have a whole customer service dental sleep expert team that can help you with all your questions along the way. And again,
I think, Guy, that the one thing I want to throw in there is you don't have to reinvent the wheel here.
Right.
What we do does not cost that much money. If you make 2 dental devices, you more than pay for our services for the entire year. And we have an unbelievable amount of continuing education in there, and search engines. Tomorrow night I'm doing an online study club. Guy and I take turns doing these every other week, where, you know, I have 12 questions. I got to put a PowerPoint together tomorrow. We have questions about, how do you handle Medicare patients with this and that? How do you make a device tighter? You know, how do you deal with the hurting jaw? Those are the thousands of questions that you have, and who are you going to call? You know, so we like that. Take us for a spin.
Yeah, and again, just type in free trial. We're not high pressure people, but I can promise you, you'll learn a lot in a couple of weeks. Even if you just have some questions, just type in free trial. We'll contact you and help you with your hurdles, and you can see what we can do, how we can help you go from wherever you are in dental sleep to where you want to go far, far quicker. I mean, gosh, I think about all the time we spent trying to figure this out, and now we've got it all laid out there for you. Also, for those people who want some more information, just go to dentalsleepinsider.com and you can sign up for our free online magazine. We publish that once a month. There's videos in there that we do, articles that we write, and it's really pragmatic. It's just we get really high reviews for this because it's just kind of like this webinar. Hopefully, this has been kind of an overview. We even get down to more nuts and bolts of how you do this in your practices. So you can review all the past ones there too. So just dentalsleepinsider.com, and you can see that free publication. Hopefully you can see it on your screens. These are the upcoming ones of these type of webinars we're going to do with Keller. The next one, we're going to start right into those 4 pillars of dental sleep and talk about them as a big overview, and then we'll get down into more details on the subsequent ones. If you can't read that, I think it's May 31st is the next one, and then June we have one on screening and testing, and then we're going to talk about the role of CBCT. As I mentioned earlier, have that OP300 KKGI instrumentarium unit in my office that we're really starting to enjoy using, and we'll talk about that. And then we'll talk about which devices they use. We'll go into the 4 devices Rich and I use mostly, and billing issues. So we've got a whole continuum set up. Hopefully we'll have a big attendance for all that. And I promise to put these courses back up. Again, these courses are great value at the normal fees. The one-day courses are normally $295. We'll give you $50 off for $245 if you just type in free course and sign up by tomorrow. And the 2-day courses, $995. You get a dental device made for you as well. As a lot of hands-on in that. The first day is a lot more of kind of the information you need. Then we have a lot of time for hands-on the second day. And those are $995, including a team a member that's included in that $995. And again, if you type in course and where you want to go and sign up by tomorrow, Eric will get you set up with that. You get $200 off on that, and so that's well worth it. So just let us know, and you can at least talk to them about that. So I think we look at that, man. We're even with the computer problems, we're finished in time here for some questions. Richard, are there some questions we need to answer that typed in? I know you've been managing that.
I've been doing pretty good with the questions. Yeah, so and we're getting people saying course and free trial and things like that. So again, you don't have to reinvent the wheel. We're not real high pressure, but we're so proud of what we do, and we're changing all the time. We're evolving. We're changing. You're talking to 2 dentists that got their finger on the pulse of what's happening here, and we'd love to help you guys get this going in your practice.
Yeah, very good. So if you have any more questions, type them in there. You can raise your hand now if you really want to. Something that was a little hard to type, we'll try to unmute you. If I see any hands raised, and we try to respect everyone's time. Oh, someone's raised their hand. Looky there. Let me see if I can figure out. They've got a lot of attendees here tonight, so it'll take me a second to find you. Hang on. Where's the hand raised? No, it went down. Someone chickened out on me here.
We have one guy about to put the slide up again for the Dental Sleep Medicine Insider.
Okay, maybe that's it. All right.
Yeah, a couple of people have asked again about how do we get into that journal, and we spend an awful lot of time doing that. We have, and it's a digital magazine, so you just pull it up with your web browser on your internet. You click from one page to the next, and you can look at articles in there, and some of them are videos, and a video will play right inside the magazine page, and we're kind of high-tech people. We like that kind of stuff, and a lot of good information out there. There was one question, too, Guy, about a textbook. The Principles and Practice of Sleep Medicine is really the best textbook out there on sleep in general. All 1,500 pages of it. You can knock somebody out if they break into your house with it as well. And Hokema study, the one that we briefly mentioned, a guy named Arnaud Hokema, H-O-E-K-E-M-A, Hokema, his thesis for his PhD was done on comparing oral appliances to CPAP, and that entire textbook can be bought through the American Academy of Dental Sleep Medicine. I think they charge like $20 for it.
Yeah, and I buy those by the dozen and give them to my referrals because it has that study. And the people, the physicians I meet, I write a little note in it and hand it to them, say, check out chapter 4 here where it has that study we went over. Other than that, we'd be remiss if we didn't mention that take this with, we believe in what we do. We're very proud of what we've done, and we've worked very hard at it. We have some of the best, I think the best, educational materials available through DS3, our Dental Sleep Solutions system. We have videos, we have manuals we've written, everything from step-by-step, here's how you do this, to videos showing you how to do that, to a thing called Snoozle, which is the only, as far as we know, dedicated dental sleep medicine search engine. Snoozle, I'll say it again. Jason, who is one of our favorite team members, he came up with that, and it's really, you just type in there, titrating a tap device or something, or tap device, and it'll tell you, everything you need to know, videos, articles. So we have the biggest resource of anyone I personally know, and I think we would know about them for all your information.
Can you put up the Keller webinar schedule again, Guy? Somebody asked for that.
There you go.
So we're doing the dental sleep. You can do this. You should do it. So the next one's the 4 pillars, and that's on, I can't read that real well, Guy, May 31st.
May 31st, I believe it is. And you can email us, too, at info@dentalsleepsolutions.com if there's anything that you missed here. June 20, I can't read that either. I'm too old. Sorry, I thought about breaking that into 2 slides, which I probably should have. In July, I think it's the last Tuesday in July, I'm relatively certain, because I'm going to be doing that one from the Keys, because the next day is lobster season.
We don't want to hear about it.
So
okay.
I know, I saw that on the calendar, and then August 30th, I think it is there, and then it's the 27th.
You can get those from Keller, too. You guys can call Keller. You can reach out to us at info@dentalsleepsolutions.com, and we're glad to give those to you. And
And here's the courses again, and let's see if we have, there's our contact information again. So it's probably the easiest way to get a hold of us, 877-95-SNORES. Another way, you can call that number. And you manage, I really appreciate, Rich, you managing all those questions. Is there any more on there?
Well, I'm happy to do that when you put the PowerPoints together. That was pretty easy for me, so thank you.
Yeah. I'm looking forward to the next one. I hope we have as big of a thing. It's this, I know this was kind of not a whole lot of exactly what you need to do in your practice here, because you need to kind of have the foundation and the overview. We only have an hour. We promise in the ones coming up, no one gives more pragmatic information than we do, just practical, here's what you need to do in your offices. I think that's where we shine, because we've done thousands of devices. We've helped hundreds and hundreds of dentists and thousands of team members implement this in their practices, and so that's what we're all about. We want dentists to do this easily. We don't want to be some big mystery to where they've got to stop everything in their practices to do this. You all should be able to deliver mandibular advancement devices for your patients, help them get tested, and treat these patients in your offices, just like you do fillings or crowns or root canals, whatever else that you like to do. I'll even say dentures, because I like doing dentures back when I was doing my office. So whatever you like to do, we'd like to be able to get that pulled up for you. See, click here to see those whose hands raised. Okay, here we got some people's hands raised. I figured out who we are. So I'm going to, Sherry, I'm going to unmute you here. You have a question? Is it Dr. Thom? I've got you unmuted if you want to ask a question. Going once. All right, we'll try the other one here. Rosanna? Rosanna, did you have a question? Okay. Everybody's gone home. So we'll try the last one that was raised. Homa. H-O-M-A, am I saying that right? Do you have a question? Okay. So I think they may have typed them in and got them answered. So anybody else typing anything in, Rich? Or we?
Nope, I think we're good. So we're pretty much right on time. So thank you guys so much again for spending your evening with us. Right. And we certainly hope that you will take what we said to heart. And in summary, start identifying these patients in your practice. Start screening them. Learn something about this. Go to a course. team up with somebody like Dental Sleep Solutions. You know, you don't have to reinvent the wheel and just get this going. It can be very lucrative as well. You know, we didn't talk much about that, but and the other Keller webinars. You know, sometimes if you got a real busy dental practice, that's your worst enemy sometimes. So, but you know, dentists aren't making quite as much as they used to these days. So people are looking for a reason to do something else, and we're all for that as long as you do it right. And you're gonna, you know, if it's worth doing, then it's worth doing right. And I think that's fair to say. So, thank you guys again for spending your evening with us.
Yeah, thanks a lot. Just let us know if we can help. That's what we're here for. Love to hear great stories about dentists starting to do this in their practices. Everybody have a nice evening, and hope to hear you on the next webinars coming up.
All right. Thanks, guys. Thank you, guys. Have a good evening.